In Vietnam, way that they think about mental health, they think about very in the extreme way. Usually they think about like crazy or schizophrenia or psychosis. If you went to a psychiatrist, your life done.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're speaking with Mr. Tran Anh Vu, a psychologist who works at his own private practice, the Giang Vu Psychological Counseling Company based in Ho Chi Minh City. He provides psychotherapy services for individuals, children, couples, and families. Currently, he's a doctoral student of counseling psychology program at Assumption University in Thailand. He holds a master's degree in counseling psychology from the Assumption University as well. He has practiced under the supervision of experienced therapists from America and Australia. He has had 11 years of experience working in counseling and psychotherapy field in various settings like clinics, social agencies, and universities. He has worked with very culturally diverse clients from many countries. So, Mr. Vu, it is really great to have you here on the podcast with us, and we're going to talk about mental health in Vietnam. And so in getting started, what made you become a psychologist?
Well, I must say at first when I want to choose my major of psychology, I follow my curiosity of human nature and human being. I like to understand about how people think, feel, and behave in certain ways. But then gradually, when I study my undergrad program, I kind of inspire my professor when they say about their clinical experience, when they work with their clients, and when I expose to some like experiential activity and like some training, I start to like and start to like curious about like become a counselor or become a mental health practitioner.
Was there like a specific event or experience that you had that really drove you into mental health?
I remember when I'm in the middle school, I'm kind of, I think, I remember like my friend, uh, like some of my friends told me that you're really good at understanding people. So then I start to thought, I start to think about myself that, so it means maybe I have a strength or I good at psychology because I understand people well, and because my friend came to me and say about their personal story, and I learned how to have them like empathize with them with their story, that kind of thing. So from very early experience like that, and my friend had me realize that, maybe I good at psychology, and this is the first time that I start to be interested in psychology. At first I think that if you want to become a psychologist, you have to become a physician first or the doctor first, but I'm not good at chemistry. Yeah. And I think so, chemistry and biology. So I kind of dropped the idea of become a psychologist. But then later I realized that, I don't really need to study that. So I'm good at the language and a little bit like logic, math, and like English, that kind of thing. So it's helped me get into the undergrad program of psychology.
Okay, interesting. So it kind of
Mm-hmm.
started with just caring about people and helping
Right.
them.
Yeah.
And so what is typical academic training like in psychology here in Vietnam?
So usually right now, like in Ho Chi Minh City, there's a lot of like more than 10 undergraduate program of psychology. Mostly they focus on like theoretical teaching, and just a little of them is a little bit focused on clinical training or skill training. Actually, because like when I study my undergrad, we don't have like master level program, but right now we have master level program in Ho Chi Minh City and in Hanoi City.
Oh, interesting. So the field has changed a bit too.
Yeah. So I mean, like they try to open master like graduate program in clinical psychology. So it's mean like the student have more chance to advance and become a professional practitioner. Yeah. So right now, and for doctoral program is only one program in Hanoi educational university. They provide that.
I see. So it seems like a pretty new field then, if
Right.
they just started a master's degree recently.
Right.
Okay.
Very new. Very new.
I see. And so, what are mental health services like for people in Vietnam?
There's a different kind of mental health services, like for example, like for children and adolescent. So you have like testing assessment, like cognitive assessment. For example, when your child or your adolescent have some like learning difficulty or some neurological problem, you may want to bring them to like pediatrist or to child clinician for assessment, whether they have like ADHD, autism, or learning difficulty like dyslexia, something like that. Speaking about like emotional problem, so maybe your child have some tantrum or some emotional dysregulation, some disorder, something like that. So you want to bring your child to a clinical psychologist, so then they can do assess, they can do some intervention, they can give the advice to the parent how to parent your child, how to adjust your parenting style to have your child regulate your emotion, that kind of thing.
Yeah. So, are there public facilities for psychology to help those families?
So it depends. I mean, like it depends on the individual. Some of my friends they focus on empathies on child and family. So they study and then they give some training. They give the workshop and training for parents to learn how to learn the skill, parenting skill. So I think like it's kind of they try to give some psycho educational program to the parent. Um, and there's a different type of mental health service, like the service in university or school, like school counselor or career counselor. Like they hire a counselor, so then the counselor can provide the individual counseling, as well as like to give some life skill workshop to the student, something like that. In hospital or in a clinic, so they can give some like mostly from psychiatrists, so they can give like proper official diagnosis for for the adult or for the children, for adolescent. And then they also have the clinical psychologist to give the counseling and to give the psychological intervention combined with the medication prescribed by a psychiatrist.
I see. It sounds kind of similar to the States in that you
Okay.
have, I guess, counselors at the universities, or I'm not sure if like high schools too,
High
to help
schools, right.
the kids. And then I guess if someone later in life is having issues, they can go to a private psychology practice, right? Okay. And then how does the cultural perception of mental health in Vietnam differ from that in Western countries?
Yeah. So in Vietnam, mostly they think the way that they think about mental health is very in the extreme way. So when they think about mental health issue, they think about like craziness or schizophrenia or psychosis. They think like if you went to a psychologist or psychiatrist, it means your life done.
Oh, wow.
It's mean like you gone wrong totally, and you go crazy, and something like that. But actually, they don't understand that most people don't understand like mental health. present in the bedroom. Yeah, if in terms of functionality. So and also there are different kind of mental disorder, and it doesn't mean that if you went to a psychiatrist mean you crazy, but it has a different thing. And a lot of people they suffer. I mean, like a lot of people they suffer from mental disorder. Or just similar like life problem, like relationship problem or career problem, something like that. So you mean like to prevent them from seeking any help, right?
Yeah.
Mostly they got difficulties in validating their feeling. So they feel like something wrong in their psychology, but they cannot, but they don't know whether it is true or not. They don't believe in their feeling. They think, oh, it's just my thought. Or when they try to talk about it, their experience, inner experience with someone, or with their parent, the parent just or someone just gave them a very simple answer like, oh, you just think too much, you just overthink. But actually it's like more than overthink, right? Usually when I work with my client, I'm trying to help them understand about their mental health condition, mental health status by to help them validate their feeling and their inner experience, because some of them they tend to invalidate their inner feeling, inner experience. And then they have them to understand about the mechanism of their mental mentality or mental disorder. So then they understand about what's going on in their mind and why they think in that way, why they feel in that way. Um, so actually, I think that there needs a lot of we as a practitioner needs a lot of psycho education for clients to prepare them, because usually they go to the service, but like they have no idea what's going on. And sometimes we just focus too much on the professional thing, but like we forgot to explain. And then they like they get out of the room and then they think, oh, what just happened? I didn't get it.
They didn't get it.
They didn't get it.
Well, what do you think is actually the driving factor that finally gets someone to seek help?
Mhm.
Because if they're kind of used to hearing, oh, you're thinking too much, or kind of being invalidated, what do you think actually drives them to the point where they can know that they want to see a psychologist?
So usually, maybe I would like to talk about the most motivated client. It's been the one who determined that, oh, I want to go to a psychologist to deal with my problem. So in the case, usually when they validate their experience enough, I mean, when they understand about their problem and they think, oh, I have that kind of problem and I need to deal with that. So they understand it very clear. The they can verbalize, they can understand it, their problem in technical or in some term, like they can put it in some verbal terms. And when they feel like they cannot suffer anymore, they cannot bear those experience anymore, they cannot bear their distress anymore, they have to seek for help.
I see. So it's kind of like when the condition becomes extreme enough that they know that there's no other option. I guess that's kind of similar to other areas of healthcare, where usually what happens is a lot of the times the patient gets a little bit sick. They'll talk to their family members. They'll go to the pharmacy, try taking something, then get worse. And then once they're, they can't help it, they know it's going to get worse, then they finally go to the doctor. Seems like kind of this similar in psychology, but maybe even worse in psychology, because there's a bit of a lack of awareness. Like people don't know like what mental health is. There's no kind of ways of like describing, okay, like anxiety or, depression or not as much awareness of that.
So I believe that there's a different level of the client when they come to term of mental health care. So the lowest level, that when they feel like they're dysfunctional too much, they need to seek for some help to to relieve their symptom, like to heal, to deal with their problem, because they cannot stand anymore. And The high, the middle level is like they kind of aware of their problem, and they want to directly deal with that. And also they have some certain understanding about, like they kind of believe in science, because psychology like based on science. Because also there's a lot of people, they direct their needs of mental health service into other service, like praying, it's okay, or go to fortune telling. But actually it is the needs that you need to look into yourself, not actually look something outside or look for explanation from the planet or from the destiny.
Yeah, I find that so interesting too, because I
Mhm.
see a lot of like especially young people, young girls
Uh-huh.
are really into like going to like the fortune teller or
Right.
seeing like the cards and stuff. And it's the same thing. And so I'm from the US, from the state of New Mexico, and I've been able to live in Mexico a little bit. And I saw a lot of the times if someone is feeling bad, they'll go to see the fortune teller, right? And then they'll talk to them. They'll like discuss their feelings. And so I guess like kind of maybe it's like almost like a traditional version of a psychologist.
Right. Actually, it is a traditional form of helping. Yeah, go to fortune teller, and the fortune teller, because they have a certain experience, working with people, so they can understand by reading people, and then they know how to calm them. Like it's different from the intervention.
Of course, yeah.
The
Completely
intervention
different.
and the framework, how you frame the problem, how you understand about problem is totally different. So I'm not saying that we better than a fortune teller or any kind of helping like religious leader or a religious leader, but like I believe that what make us different is we based on the science, we based on the intervention, have evidence based, is evidence based. So then we can explain about what we do, why we do have to do, why we need to do that, what we do, and how, and prediction about the outcome, that kind of thing.
Yeah, that makes sense. And so, what are typical issues that patients come to you with here in Vietnam?
Oh, can I talk a little bit reverse to
Sure.
so and I think the highest level of mental health care is that I actually have some client who be able to reach to that level. It means they come to mental health service for prevention, for just care. It's like you go to gym. It doesn't mean that you have to be serious sick that you need to go to gym, but like you go to gym just for care or for taking care. So some client is very like I understand that, like I remember my professor, he said like in America when they have a little problem, they go to the therapist. They don't wait until it's become severe.
Yeah, definitely. There's this whole idea of like mental health is wellness, and people
Wellness.
going and talking to their therapist. It's become a lot less stigmatized there. Is there a lot of people in Vietnam who are seeking therapy services as wellness too, or not yet?
Yeah, I mean, like from my experience, I think there are a growing number of young people. They become seeking. I mean, like they seek for mental health service more than like the older generation. Become that there's several reasons for that. Like they're more open, and the world become flat. So there's a lot of idea they can absorb, like from internet. I mean, they kind of modernized than their parent, their grandparent, so they absorb a lot of ideas, and then they also are better about understanding their emotion and their feeling, and they want to, and they kind of active to deal with that.
Oh, interesting. So most of the clients would be younger, seeking the services out themselves, a little bit more aware of their situation.
I can tell from my observation, like they respond better to the service.
See, and would you say that the majority of your clients are younger?
No, not actually that, but Yeah, I must say, like the younger, they have a better approach to the service, and I think it's a new. This is quite promising when the younger generation, they feel okay. They're not shame to you that kind of service. Like some of my clients from older generation, even they don't want to tell me their real name.
Oh, really? Wow.
They don't want to tell about real name, and they hide different information about themselves because they don't feel like totally secure
Yeah.
to talk. Even like we very firm at principle of confidentiality. Yeah, but still, yeah, okay.
Yeah, no, interesting. So,
Mhm, mhm.
and I guess one thing that a lot of people, I guess like internationally, they might not know as much about like the amazing progress that Vietnam has made economically over the past a bunch of decades. It's one of the fastest growing, economies in the world. But sometimes, especially with Americans, they just think about like the war period. And so, do you often deal with like issues like PTSD and trauma, especially in the older generation? And like, how does that kind of inform your practice?
Right. So I must say like PTSD, but it's not like a typical PTSD when people mention like go to war, got traumatized. PTSD here is mostly like when the client got like abused, violent, kind of like different type of violence or abuse, and they're traumatized by that, and it still affect them the way that they grow up as an adult. So I deal with the client, the presenting problem, presenting symptom. But when they have change and they allow and they want to go further, I also can help them to deal with like their past, their childhood, that kind of thing. There are different technique, different skill that we can apply, to help client to get over the traumatized experience. But like it takes time,
It takes time,
right? It
right?
takes time.
And then I've read about like intergenerational
Mm-hmm.
trauma too, where if maybe someone's parents or
Right.
grandparents went through, like a very difficult period, or it was instability or war or something, some of that trauma can get passed down.
Mm-hmm.
Is that something that you ever deal with at your practice?
Right. So intergenerational trauma. So when the family like function in a certain way, very rigid and sometimes like pathological, and it's passed down some very unhealthy pattern of behavior that the client unconsciously learn from that, and we have to get the client understand or be aware of how they behave in that way and how much free they actually are to choose their behavior, rather than just follow, unconsciously follow their own pattern from family. So it's very interesting work, but also very difficult and challenging, like for any clinician. I'm sure that there's a lot of traumatic experience throughout the generation in Vietnam, because like we just got out from war, and there's a different thing happen, and usually because there's a lot of difficult in emotion and feeling, people tend to from older generation, people tend to ignore their emotion. They don't talk about their emotion so much, so it's stuck in between. So it also create a lot of difficulty for the younger generation to understand about their parent, understand about what happened in the family, to make sense of that. And
How do you help those patients to understand something like that?
we use a different approach to deal with that, to have them understand about their family structure and their family dynamic, and to understand about themselves, and to relate it between like their symptom, their behavior into the family pattern, something like that. Yeah.
Oh, it's really interesting.
Right.
And so, how is the perception of seeking mental health care changing over time? Because like Vietnam is changing so much as a country, right? Like think about like from what happened with like your grandparents to now being one of the fastest growing economies. How is mental health keeping up with that?
Keeping up with you mean the pace of society?
Yeah. And I guess, like, how are people adapting to it? How is, like, the perception of seeking mental health care changing?
I mean, like, because when the economy growing so fast, and there's a generational gap, and there's a lot of different things that the parent found. Oh, if it's difficult to understand my child right now, and the child also found the same thing, find the same thing. Very difficult to understand their parent, and when the child got problem like mental problem, they need to find a way to explain to their parents, so then parents gradually accept and gradually understand about their suffering. It also take time, a lot of time, but like when in family that there's a acceptance between the parent and the child and the children, so the client, is mean the children, will be much faster for for the mental health improvement.
Yeah, I see.
Yeah.
And how is mental health portrayed in the Vietnamese media? Do you think it's portrayed accurately, or are there any misrepresentations?
I think it's very new, still very very new, just a beginning step of mental health promotion, but it is for me, I feel promising about that. So Vietnamese people start to care more about the mental health issue, and I can say that you can observe from right now in Ho Chi Minh City there are more than 10 undergrad program of psychology, which mean like maybe I overstated, but like there's some care, there's some like concern, like at least among the young generation, about the mental health and psychology. And sometimes they study psychology, just they want to understand about their problem, and they understand how to deal with their problem by their own. Yeah.
Is mental health ever kind of like discussed in TV shows?
Mhm.
Or like how is it portrayed? Yeah, like I guess in like TV shows or kind of like pop culture in Vietnam.
Yeah, this is the thing that they tend to invite some famous psychologists. Mostly they kind of they work in the educational area.
But are there like TV shows, kind of like, I don't know, like in US, like reality TV is so popular, and every once in a while someone will, talk about seeing their therapist.
I know about that,
Yeah.
but like no, right now that they no TV show like that
Not so
in
much.
Vietnam. Maybe in future they will. I heard some TV show like in Korean or in America.
Well, I know Korean dramas are quite popular here, so maybe the young generation are kind of
You
seeing
think
those
so?
discussions, huh?
Yeah, we have to see, because in our area the confidentiality is always the thing. Is like, for example, if you invite some volunteer client, even they okay, but how you keep confidentiality and how you make sure that when that story is popularized by the TV show, after a few sessions, how it's going on and how we estimate the outcome and consequences of the person. It's still a very trick. I think it's still a very tricky question to answer right now, especially in Vietnam. We still lack of a lot of practitioner. The rate of mental health practitioner in Vietnam very low.
Do you know what it is?
No, but like when I talk with my professor when in my university, like she's kind of surprised that how low the rate of mental health practitioner in the Vietnamese population or Ho Chi Minh City population.
Yeah.
Yeah.
Yeah, what do you think are like the biggest challenges facing mental health in Vietnam today? So you mentioned like very few practitioners.
Okay. So I think there's a lot of challenges about you mean like the challenging about you access to a mental health service, or
Either one, yeah.
either one. Okay. Like for example, like for the mental health practitioner, we still need a lot of training to get proper training for different topic, different problem. We don't have enough qualified and validated practitioner, and somehow we have to compete with a lot of like semi-professional
The semi-professional.
Like it's like the person who don't have like psychology or any human science background, and they just took one or two certified training, and they announce themselves as a psychologist, which is very unethical. But we don't have a certain we don't have like a clear, we don't have law or regulation to deal with that kind of problem. And then the client, they at first maybe they don't come to us, but like they come to a professional, which is no one can ensure about the quality and ethics. And then that kind of semi-profession, they did something very weird, and the client just lost their trust into the mental health service.
That's a big problem.
Right.
When we were starting Docosan, we realized that there was demand for mental health services, and we started looking into, okay, how can we find psychologists to onboard? And then we realized there is this big gap in regulations a bit. So for psychiatrist, or for like a primary care physician or an OBGYN, that you have to have a medical practice certificate. There's kind of like, standards and things that you have before you can practice. Right. But then we realized in psychology, there weren't very clear guidelines. And so then we had to kind of make our own too. And so we decided, okay, we look for people that have, clinical experience, master's degrees,
Sure.
because there were people that were approaching us that were like life coaches. And I, of course, would not be comfortable sending a patient who is maybe dealing with a severe mental health issue, maybe like they're suicidal or something. You don't want to send them to a life coach.
I see.
It can be life and death. But yeah, that was something that we noticed too. And I think,
I
but
see.
it does reflect on like how, I guess, kind of like new, like mental health and psychology practices in Vietnam. But I'm sure it'll, pick up more popularity and speed and get there soon.
Wow. Yeah, and sometimes the community, they don't know how to validate a reliable practitioner. Maybe they just saw on the TikTok, on the social media, who is the more popular, and they come to that person. So it means like if you have some trick or some technique, that you can get a lot of clients, but like no one can ensure about the outcome of how you practice, because there's no regulation.
Yeah, and that is an issue. Are there specific mental health issues that are prevalent amongst certain demographics more than others?
Maybe just speaking from my experience, that I think that I have an opportunity to work with a lot of LGBTIQ client. So I think it's just quite a population needs more care and attention from community, because they have to face with a lot of discrimination. And some people, they don't just aware of what they did is a discrimination to certain people. So kind of they had to struggle, the LGBT client, they had to struggle with a lot of different things. When a straight person, they don't have to go through so much struggle like that. It's like identity or career or relationship. They got much difficulty to deal with all of that kind of thing. And there's a high rate of suicide and depression, suicide, because and they also been traumatized a lot. Like for example, when they go to like middle school, high school, when people get puberty, and the kid, they just don't understand, and they react to a friend which is like not have an unusual behavior of a gender. They just react to that, and sometimes they bully. But like I used to work with some of my clients have a severely damaged by that kind of like bully behaviors, and I have to have my client to deal with a lot of different things, like like personal thing and personality problem, and suicidal tendency, that kind of thing. Yeah.
Yeah, I guess like what are ways that like what can we do as like a society, like here in Vietnam, to better support LGBT people?
Right. I usually first we need to raise awareness of that. The good thing is that I feel like our culture is quite flexible. It's kind of same with Thailand, kind of flexible. It has more feminine characteristic than masculine characteristic. Like in cultural psychology, we divide. Some country have more masculine characteristics. Some country have like feminine characteristic. Like Vietnamese consider as a feminine characteristic culture.
What do you mean by that?
It's been like more flexible, more acceptable, that kind of. But like less structure. People like too much flexible. Like usually they don't tend to follow strictly with the time, the structure and rule.
Yeah.
Yeah. So a good thing that like I don't know what it is in other province, but like at least in Ho Chi Minh City, like, sometimes I can say like a lesbian or a gay couple, they can go together. Sometimes they hold their hand. I think so. Yeah, I mean like they can do that on the
Yeah.
street. I think it's like a very important step for human right and then for equality. I think so.
Yeah, I've seen this in Ho Chi Minh City too. I
Oh.
think like compared to certainly a lot of other countries, Vietnam and other places in Southeast Asia are a lot more open and kind of
Right.
like accepting.
Accepting, right?
Yeah, accepting. Certainly still like issues here, but yeah, there's not the kind of like intense stigmatization as there is in kind of like.
Oh yes, sometimes I got some case like LGBT case, and I found it also very difficult to have them deal with the family acceptance. But very struggle to deal with that. But I stand my ground. I think so. I stand my ground because I think that I don't want to. I mean, like right now in Vietnam law, they actually say that if you do some conversion therapy, it's considered as unethical.
Good. I mean that is quite a progressive rule.
Right, versus
Yeah,
right.
and I've seen Ministry of Health sometimes has statements too that it's illegal to discriminate against LGBT population, and I think like they are quite progressive in
Right.
treatment of that community. Still, globally it can be better, but yeah.
Yeah, with LGBT client, I usually would like to have them to build their inner strength because I know that they don't just have to deal with their own problem, but sometimes they have to deal with the society social oppression, something like that. And I need to make sure that at least someone who have their back, like someone who's also stand for them and encourage them to be themselves, like encourage their identity, that kind of thing. It's very important. It's very important. Right. I think so.
Yeah, great. Okay. And then are there any new technologies that you're excited about in mental health?
Right. Yeah, this is very interesting question that I think that first I think about like the mental health application like that you can easily download. Usually I advise my client to use like mood tracker. Mood tracker. Right, mood
cool.
tracker. It's a very simple application, but like usually like we don't have the habit to record our mood or to like simply just ask ourselves a question like how you feeling today, something like that. So the application become a companion for the client, like to record their mood, and they can see, especially for clients who have like mood disorder, it's very helpful for them just to track their mood, like they can go up and down. But but like some of them also have difficult to accept, to understand about their feelings. So then I have them to do that. So they can start to be like, oh, I have that kind of feeling. I have that kind of mood. When I don't just go numb. So this is like meditation guide, easy step to follow. Do some meditation or relaxing or breathing exercise. Like AI chatbot, I have a, I don't know, they can substitute us, but like, but sometimes they're very smart, AI chatbot, like, they can ask very spot on, question. How you feeling? What you think like that? The three critical thinking very good. But me, I guess like Sometimes you also need some person, listen to you. You also need some that kind of human quality, something like that, be involved. And other thing is, I think like application, though application can have mental health more material, more accessible to community, and somehow it can normalize the stigmatize of the society about mental health.
Oh, interesting. So even, yeah, just by having a bunch of kind of like consumer mental health tools and apps, it kind of normalizes seeking mental health, or makes it not quite fun, but like better, right? Like, you've got Facebook, you've got TikTok, and then, okay, I've got my meditation app. Feels more normal. And then I guess also something else to note too. So Mr. Vu is one of the very popular psychologists on our network, and you do a lot of telemedicine. Like, how do you think about like telemedicine and telepsychology?
Well, telemedicine or counseling is, I think like it become more popular when we had to go through the pandemic and people cannot meet in person. But then we found a new option, a new possibility that we can reach out to the client. Actually, a lot of client have more comfortable to use like telemedicine service. Because like they don't have to repair their clothes or their riding, like they commute to the place. And like also the fees, because if you want to hire a place in the center of the city, so the fees become very expensive, and it can deal with a lot of problem. And like they can work, and they can save 1 hour to talk to me, and then after that they can go back to work normally. They don't need to sweat out.
Yeah, no,
Something.
I think it makes it a lot more accessible and even like affordable. And I guess it's interesting what you said too about just being another option, because some people will like to go in person. They need that human connection. But some people, it's just nice to have options and different ways of getting care.
It's very interesting when we put in a way that, some people, they not actually, like some people, they actually more comfortable with like to talk with someone, like to have the screen in between. Because some people, they get nervous, or they feel like it's too much close to them when they talk like in person. But I'm sure like in person always brings some experience, very different, unique experience. Sometimes I have my client, like the client usually do like telemedicine, but like sometimes when I need to do some technique or some intervention need like in person, sometimes I ask them to come over my place to do that. And sometimes we have a wonderful experience,
Even like hybrid. Oh, that's
hybrid,
interesting. Yeah.
right, hybrid. So and actually it took a lot of time. When I watched some conference in US, like some very famous psychologist, right? He very old, and he talk about, at first he very doubt about like telemedicine, telecounseling, psychotherapy. But like when he did that, he's surprised about like how deep he can go with the client, just by like to talk with the screen like that. So we still have some effective. I must say, like if we consider face to face or in person, like 100, maybe telemedicine can be like 80-90%.
Yeah, pretty amazing.
Right.
And then I think as a practitioner too, it's also interesting because you're finishing your doctoral degree in Thailand, but you're still able to help some patients here in Vietnam.
Right. This is a very advance of that. So if not, I still have to stop to provide the service to my client, and it's very like difficult. But like because of the technology and thing, I still be able to have my client in the distance, in the remote. And fortunately that our job is mostly like talk, well, like we provide talk therapy, so we can talk in distance.
Great. And do you think, is there anything else that our audience should know about mental health care in Vietnam?
I think there's a message I want to send to community about mental health service. Usually, people think when you come to a psychologist or psychiatrist, it means you weak or you insufficient or you crazy. But in fact, it actually not. When you deal with your problem directly by seeking for help, something like that, you actually strong enough because you be able to deal directly with your problem. So I want to encourage community to go and seek for mental health service when they want it. And I'm sure that there's a lot of psychologists in Vietnam, like my colleagues, a lot of them, they try to improve their skill, their knowledge every day, just to make sure like their client can be helped properly. And we also try to do that every day because we know that if we don't put our efforts, that there's no improvement in mental health in Vietnam.
Yeah, and it's something that I absolutely love about getting to be a part of Docosan
Mm-hmm.
is getting to meet wonderful clinicians
Mm-hmm.
like you.
Mm-hmm.
And I see how much you guys care about the patients,
Right.
how hard you work to help them in moments of need. And it's so great to be able to tell these stories with the rest of the world because there's amazing stuff going on here in Vietnam.
Right.
And so if anyone is struggling or needs help, there are so many great psychologists, including Mr. Vu. You can find him online on Docosan. We'll put the links in the description. And so thanks so much for this really interesting conversation, Mr.
Thank,
Vu.
thank Beth.
Our listeners can find Mr. Vu on Docosan. The link will be in the description. And thanks for listening and catch you later on the next episode of Demystifying Healthcare in Vietnam.